Good afternoon, everyone. We'll just wait for a few more minutes for people to join in. We'll shortly begin the session. If you have any colleagues, you can tell them to join as quickly as possible as we are about to start this session. A warm good afternoon to one and all. I welcome you all to Homeopathy Musings. And for those who have come for the first time on our platform, I welcome you all and we wish to see you in our future musings, which we conduct every month on the first Saturdays of every month, precisely from 2 p.m. to 4 p.m. It is a free musing session. It is a session for all homeopaths around the world, and everybody benefits from this as we discuss various topics on this platform. So we have expert speakers who come on this platform like Dr. Shekhar Algungi sir, Dr. Ajit Kulkarni sir, and a lot of other specialized homeopaths who come on this platform and share their experiences with us. And we are very happy to conduct musings, and we are in the third year of our musings. And we welcome you all, and we encourage you to join us every first Saturday of the month. So our ongoing modules are the plant module, which is a one-year module consisting of 36 sessions spanned over the year of 2023. So we have already begun the plant module in the month of Jan, and it will go up to December. And the recording for this plant module will be available for 2 years. So So everything about the plant kingdom, right from the subclasses, the orders, the families, the closely related remedies, and differentiation between the animal and the mineral kingdom will be discussed in the plant module. So far it's going successfully. Our participants are enjoying it. In case you feel that you have missed the bus by registering for the plant module, you can still do so for the entire year. Or in case if you do not wish to commit for a year of learning the plant kingdom and wish to learn just a section of the plant kingdom, say one subclass or subclass 2 or 3 together, or any of the groups of the plant kingdom, you may do so by our a la carte plant system. So you can register for any of these subclass and you can attend the session live as we go in the plant module, and you will also get the recording for 2 months post the session. So you can pass this message to your colleagues who feel that they want to learn just the portion of the plant kingdom. The key speakers are Dr. Preeti Shah, Dr. Prajakta Vaidya, and Dr. Anisha. Along with that, we also have our chief mentor of this program, that is Dr. Mahesh Gandhi sir, who comes for quick Q&A session during the plant module. So pass on the message to your colleagues. We also have Clinicals with Chanda module that has just begun yesterday. We had our first session yesterday where Dr. Chanda beautifully covered the fever and respiratory cases of her practice. And the next session is on 20th May, where she will be covering skin complaints. Dr. Chanda is very popular among the musing group, where she keeps sharing her short cases in her practice. She keeps sharing her experiences with us, and a lot of us benefit learning from her. So we thought he's the best person to discuss clinical conditions that we often encounter in our practice. And the first session was a blast yesterday. So those of you who still wish to register may do so. You can contact us on the number that is flashed on the screen. The recordings for this module will also be available for 2 months. Our upcoming module that is planned is by Shekhar sir. So Dr. Shekhar Algundi sir is back on musing, where he'll be continuing from where we left. For those of you who are already a part of our musing group, know that Dr. Shekhar sir had covered conception to birth remedies, that is row 1 and row 2 of the periodic table. And because that became a very popular module and the participants demanded for the continuation of the mineral kingdom, we have Dr. Shekhar sir who is going to continue the mineral journey with us, where he'll be taking rows 3 and 4 of the mineral kingdom. The dates are on the screen, that is on August. In the month of August, we have 4 dates, that is 2nd, 9th, 16th, and 23rd August, all 4 Wednesdays of the month. The timings are from 7 p.m. To 9 p.m. If you wish to avail the early bird offer, you may do so at the earliest. The early bird is about to end on 1st July. So for those who wish to register, the registrations are open. You may contact us for the same. In the month of September, we have the module which is called as Milk Matters. Again, for those who are a part of our musings group, know that Patricia Heatherly, who is an lactation consultant and who takes a special interest in the milks of the materia medica, that is all the lacs of the materia medica, had come on musings to share about her proving on the lac macropy, that is the kangaroo. She has done her studies and expertise in the lac groups of the materia medica, along with being a lactational consultant for over the years. She has been a guide to a lot of mothers, giving them tips and guidance on how lactation should be done, breastfeeding should be done, and the correct usage of that. It is a 4-day module where she'll be coming in the month of September and will teach us all about lactation, lactational issues that come along the period of breastfeeding, and along with that, for our homeopathic practice, how to utilize the human milk. So she will be also covering lac humanum and lac maternum in detail. The dates are flashed on the screen, that is 5th, 12th, 19th, and 26th of September. The timing is 2 p.m. For all our international participants. The timing of the Brisbane is 6:30 p.m. The registrations are open for the same, so you may contact us in case you wish to register. And now we come to today's session. So today we have Dr. Tanvi Mahant with us, who will be taking up homeopathic approach in thyroid disorders along with therapeutics. So I'm very, very happy to invite you, Tanvi ma'am. Dr. Tanvi is my teacher, my mentor and guide also. I remember my days of internship when I spent my time doing an observation under her guidance. And I still cherish those memories with her. I thank you so much, ma'am, for teaching me so many things at the start of my career. I am very happy that you accepted our invitation to come on Musings and to give us such a good topic. So Dr. Tanvi is an assistant professor at CMP Homeopathic Medical College, which is in Mumbai. She is the founder and owner of HomeoHeals Clinic, Malad West, which is also in Mumbai. She is practicing classical homeopathy since the past 8 years. And she has a special expertise in managing endocrine diseases like thyroid, PCOS, diabetes, etc., alongside seeing other conditions which are related to pediatric, skin, gastric, etc. She has a very special interest in thyroid disorders, and she is working in this area since her post-graduation days. Her post-graduation thesis topic was also stress-induced thyroid disorders in females, where she correlated the effect of stress, that is disturbed PNEI axis, and its role of development in thyroid disorders, and how to treat them with homeopathy. She has been treating thyroid diseases for the past 5 years with some excellent results. In her page, you can actually see the before-after results of the TSH values. And she is here today to share her experience with us. And currently, she is also writing a book on thyroid disorders, which is on the verge of release. She is a very honest, humble, down-to-earth doctor. And along with her patients, I will testify that she is a very good doctor, very patient with her patients, very listening, open to hear the problems of her patients and give them relief. She often messages her patients from her end and asks them how they are feeling. So there's always that touch that she maintains with her patients, and I really testify that. I really admire you, Dr. Tanvi ma'am. You are a great doctor, and I thank you so much for coming on Musings platform to talk about thyroid diseases. Just before we begin our session, I would like to inform you all to kindly maintain the basic hygiene factors, mute your lines all the while. Sometimes the lines may get unmuted. Please be careful as it distracts the speaker and the audience. You may keep your videos on, that will help in interaction. In case you have any doubts or queries, you can put it up in the chat box, which will be addressed towards the end of the session. Kindly refrain from scribbling on the screen, make your own notes, share your experiences, and most importantly, enjoy. You can use our repertoire of learning on the links that is flashed on the screen. So the links are, the first link is of the YouTube channel, that is Healing Harmony. We have a lot of free videos on our YouTube channel. And the second link that you see on the screen is our repertoire of learning, where you can use our previous modules and our sessions that we have conducted so far. For any questions or difficulties, you can contact us at the email ID that we have flashed on the screen. And for any other queries or registrations or any difficulties, you can feel free to contact our Musing coordinator, Asmita Patkar, and myself, resident doctor at Healing Harmony Homeopathy Clinic, Dr. Twinta, on the numbers that are flashed on the screen. Thank you. Over to you, ma'am.
First of all, thank you, Twinta, for such a wonderful introduction.
Thank you, ma'am, for coming.
Yeah, and I remember you as my student. Can you hear me, Twinta?
Yes, ma'am, I can hear you. Yeah.
All right. Yeah. So I remember you as a student, and it was really a pleasure to work with you also.
Thank you so much, ma'am.
And thank you, Homeopathic Musing, for inviting me to talk on this special topic, which is very close to my heart. So without wasting any time, we just begin with our topic. So I'll just share my screen. So is my screen visible?
Yes, ma'am.
Yeah, all right. So as Quinta mentioned that I'm working on this field since my post-graduation. And luckily in my practice, I'm getting a lot of endocrine patient and thyroid disorders specifically. So I have sort of developed my practice on how to approach these cases. Because initially when I started treating cases with hypothyroidism and hyperthyroidism, I saw there was some difficulty in getting consistent results. And though patients were getting better, but the problem sometimes, always used to come back because thyroid or any endocrine gland is a very sensitive gland to stressors which are surrounding us. So there has to be something more to our approach that we need to give to thyroid disorders. So let's begin with the topic today. So points which I'm going to discuss in today's session is introduction to thyroid disorder. So it is going to be a very brief introduction about what thyroid disorders we commonly see in practice and what clinically we need to see in patients. So this is again my area of interest where I correlate a lot of clinical examination finding or clinical signs and symptoms with homeopathy to prescribe. So why the symptoms of thyroid disorders are also important. The clinical examination is also important to prescribe. Here I'm going to focus a little bit more and about investigations and symptoms. I think we all are aware about it. So I will just go through those slides. The second point which I'm going to focus is going to be about homeopathic approach and what approach I have developed through my failures in my practice. What is the way to look out to such endocrine disorders? That is going to be my main focus on. And with this, I'm going to give case examples. So I'm going to share some 5 to 6 cases and they are going to be in brief. So the main focus is going to be on the approach, how I look at each of the case. I think forming a totality and prescribing is what we all are doing in our practice. But how to look up of the case and if we are stuck, what is to be required to be done in that case? That is the main thing which I'm going to focus when I'm going to talk about the case examples. And lastly, I'm going to share few therapeutics and rubrics and clinical tips. So clinical tips are going to come in between the slides also. So let's begin with the session. So before I begin, I hope I'm loud and clear.
Yes, ma'am. Ma'am, there's one pop-up in your screen. So can you just hide that?
Just a minute. Now, anything
Ma'am,
else?
I think your slide has not changed. We can see
Just
the
a
first
minute.
slide, that is homeopathic approach in thyroid disorders. That's the slide that we can see. Are you on that slide?
Can you see the? No, I'm on my second slide. Can you see my second slide?
No, ma'am, I cannot see. Ma'am, can you
Now,
stop
can you see
share?
my second slide?
No, ma'am, I cannot see it. I think you'll have to stop the screen share and then restart it again.
I'll reshare once again. I'll just share the PPT. All right. Can you see the second slide now, Printa?
No, ma'am, it's just loading. We'll just give it some time. Ma'am, it's still loading. I cannot see the slide.
Just a minute. Not even now, Twinta?
No, ma'am.
Give me a minute.
Yeah, sure. Ma'am, are you getting the option of share?
Yes, I am getting an option of share. Can you see the slide now, Twinta?
Yes, yes, ma'am. Points to be discussed.
Yeah. Is it visible?
Yeah, again, you're on the first slide, correct?
No, I'm on the second slide.
Oh.
Points to be discussed.
No, we can see the first slide only, ma'am. Yeah, now I can see introduction. Yeah,
Okay, if I'm going on the slide,
yeah, I can.
point now can you see?
Yes, I can see, ma'am. Points to be discussed. Yes, I can.
Right? Right.
Yes.
Okay. All right. In between, if there is any issue, please unmute and let me know. All right?
Yes, ma'am. Yeah.
Yeah. Sorry for the technical issue. Now let's start. So this is what I said I'm going to talk about. So introduction and homeopathic approach with case examples and therapeutic with clinical tips. So as we all know that the thyroid hormone or thyroid gland there is a feedback cycle which goes on continuously. So you have your hypothalamus which secretes the TRH, that is thyroid releasing hormone, which stimulates our pituitary, and then it stimulates our thyroid gland to secrete our hormones. So here I just want to focus on that. So there are so many disorders, okay, which come in our practice where there is multiple issues. For example, people have thyroid issues, there is some menstrual abnormalities, there is PCOS. So there are multiple endocrine problems is what we are dealing with. So in those cases, as you know, this stimulating hormone is secreted by pituitary. So in our practice, we can use pituitarinum as a remedy, okay, to sort of stimulate this gland so that it can regulate this disturbed axis. So pituitarinum can be used in those cases. It can be also used in cases where there is a lot of delayed in sexual development. Similarly, coming to thyroid gland, there are certain cases where we can also use thyroidinum to stimulate your thyroid gland. And also thyroidinum is one of the very good remedy which can be used for delayed in development. So there are so many kids which come up there. There's delayed in development in females. There is delayed puberty, and it could be because your disturbance in your thyroid gland, and that is where you can also use thyroidinum as a remedy. So moving on to what common problems we can see in thyroid. So hypothyroidism, which we see a lot of patients coming up, hyperthyroidism and goiter. They are goiter is usually associated with hypo or hyperthyroidism. Now there are few cases which also come up of thyroiditis, right? That is your inflammation of thyroid gland, which could be subacute thyroiditis. So maybe I'll talk about it in short. Now, the symptomatology we all know. So the patient might present with any of these symptoms. So sometimes the most common presentation could be, hair fall, or there could be lethargy, there could be drowsiness, no energy to do things. So, or there could be only constipation. But these symptoms, okay, why I'm stressing on this slide is very important for us to also prescribe. For example, I'm going to focus more about females because as thyroid disorders are commonly or in high percentage are seen in females as compared to males. So talking about there are a lot of menstrual issues which are seen in females because of hypothyroidism. There are scanty menses, there are menses which are absent for a longer duration with hypothyroid issues. And why we need to stress this is that we get prescriptive symptoms to prescribe on. For example, I would like to show you few rubrics. Now, talking about female, I hope you're able to see the radar.
Yes, ma'am.
Okay. Okay. So I was talking about that females now their menses are absent. So we need to take into consideration that what symptoms do female have if the menses are absent. That could be one of the prescriptive totality. For example, so if we go to female, sorry, there is. Okay, I'll show you later. There's some issue with my radar. So what I'm trying to say is, if you have female disorders, now, and for example, you have menses absent, and during that the patient has associated complaints of maybe palpitation or there is some respiratory difficulties. So you can look out for these rubrics, and you could find out remedies which would be helpful for you to prescribe on. I'll just show if this is some issue the radar. So I'll show you in few minutes. So that's why I want to focus on. So as I was trying to tell you that menses absent, respiration difficult with. Okay, we have the only remedy that is arsenic iode. Similarly, we have if there could be menses absent, patient is getting symptoms of palpitation. Again, you have the only remedy arsenic iode, and as we know, okay, arsenic iode is one of the important remedy in cases of thyroid. So I'll just now, yeah. So menses. Absent. Accompanied by palpitations. Okay, if you go to palpitations of heart accompanied by, you will see the only remedy which is present here is arsenic iode. Similarly, respiration difficult, okay, accompanied by absence menses, the remedy is arsenic iode. So this way, if you look into the symptoms, it will help you or guide you the remedy. So that's why it is very important to look for symptomatology when we are prescribing. I'll not go into symptoms because we all are aware what are the symptoms and signs which we get in hypothyroid. Now, this is a slide which I want to a little bit focus on is subclinical hypothyroidism. So there are a lot of patients which come up with subclinical hypothyroidism nowadays. So these are the cases where as we know in hypothyroid, the thyroid hormones, that is your T3 and T4 decreases and your TSH increases. But many reports which we see now in practice, what do we see is that the TSH is increased, all right, and T3 and T4 are normal or they are on the verge to decrease, but they're still in the normal range. So such cases, we call it as subclinical hypothyroid cases, but the TSH value should be less than 10. And these are the patients with present with mild symptoms, or sometimes they could be asymptomatic also. And clinical practice, okay, these cases are the major patients who are going to land up into Hashimoto's thyroiditis in future. That's why they are very important for us to treat these cases. Now, causes of hypothyroidism, mainly what we see are these three: autoimmune, that is your Hashimoto's thyroiditis, iodine deficiency, and iatrogenic. So, autoimmune hypothyroidism, subclinical hypothyroidism, here is where homeopathy has good scope and excellent results. Now, going with investigations quickly. So, what we look for in hypothyroid is obviously the TSH levels, free T3 and free T4 levels, right? Now, why it is important to check for free T3 and free T4, I'll just share a few lines on that, is because total thyroid hormones are bound to an albumin, right? And they are released from that protein or albumin into our blood cells, and that is where that free hormone is responsible for body functions and not the total one. And in many conditions, like for example, in pregnancy or some liver disease, some kidney issues, our proteins could be abnormal, and that could give to some false positive reports. So that's why it is always advisable that you look for TSH and free T3 and T4. So obviously in primary hypothyroidism, you will have an increased TSH and decrease of your thyroid hormones. Coming to again hypothyroidism, all right. Similarly, as I said, it is very important to look for symptomatology, right? Like for example, now everyone knows that hypothyroidism or thyrotoxicosis have a lot of eye symptoms. So bulging of eyeballs, that is exophthalmos, is very common in hypothyroidism. So for us to prescribe in thyroid, very important is to look for symptomatology associated with exophthalmos. So coming here, if we go to external throat, goiter, exophthalmos, okay, accompanied symptoms. So you will get so many disorders. Now, for example, exophthalmos accompanied by, now in hypothyrotoxicosis, trembling is a very common phenomenon, right? So if it is associated with trembling, choking, you have remedies like mephitis, which is given by Phatak, all right? So Dr. Phatak, who has given mentioned here. So sometimes to treat those symptoms, to treat those acute symptoms, we may require to use these remedies. So we have to look for the symptomatology and need to find out what are the associated symptoms and prescribe on those basis. So that's why for us, looking at the symptoms is equally important, and examining the patient is also important. So this symptomatology we all know, so I'll just go ahead. Similarly, subclinical hypothyroidism, right? Like we had subclinical hypothyroidism, you also have subclinical hypothyroidism or thyrotoxicosis, where in hypothyroidism the TSH is low, right, and the thyroid hormone increases. But here the TSH is low, but the serum T4 and T3 are at the upper end of the normal range. They're still not increased. So these are the subclinical cases. Even in practice, we see a lot of subclinical cases. Now, talking about the common causes of hypothyroidism, which we see, Graves' disease, which is again an autoimmune disease, toxic multinodular goiter, toxic adenoma, right?
Doctor, can you share the previous slide?
Sorry?
Can you share the previous slide? Can you share the previous slide?
All right, I'll share the previous. Subclinical hyperthyroidism, right?
Yes. Yes.
Yeah. So subclinical hyperthyroidism or thyrotoxicosis, as I mentioned about subclinical hypo. So usually what happens in hyperthyroidism or thyrotoxicosis is the TSH will drop down and hormone should increase, right? But again, in so many reports in our practice, we see that only TSH has decreased, but thyroid hormones are yet not increased. So these are the cases which we called as subclinical hyperthyroidism, and which are again a large chunk of patients which we see in practice. And yes, we need to treat them because they are on the verge of going to go into full-blown thyrotoxicosis or overt thyrotoxicosis. So these are the causes of thyrotoxicosis which we commonly see in practice: Graves' disease, toxic multinodular goiter, and toxic adenoma. So coming to investigations, I'll not share much time on this slide because there are many more things to discuss about. But yes, again, we'll do a TSH, free T3 and free T4, right? So if TSH is decreased and your thyroid hormones are in normal range, you have something called as subclinical hypothyroidism, what we called as a mild hypothyroidism, and with decrease in TSH and increased thyroid hormone, you have primary hypothyroidism. I'm not going into secondary or central causes because I have not experience in treating those cases. So we are not going to talk about those cases here. Now, talking about examination and goiter examination, right? It is very important to examine the goiter. Right from the examination of the goiter, you might get a remedy. So when a patient comes to you, right from your history, right from the examination, we need to know that what we need to treat in this patient. What are the characteristic symptoms? Now, that characteristic symptoms could be in patient's history. It could be in some pathological symptom. It could be in clinical finding, and that is why it is very important. Now, for example, for me to share, I've shared few remedies here. I'm going to share this detailed about correlation about clinical examination and what remedies to think about in my upcoming book. So here, if you see diffuse soft goiter, so if you have a soft goiter, you could think of remedies like lapis alba, iodine. If you have a firm and slightly hard goiter, you could think of remedies like spongia, calcarea floor, kali carb. Even for hard goiter, you have bromium as a remedy which you could think of. If it is a tender goiter, or if, as I was talking about thyroiditis, right? You have remedies again like iodine, spongia, natrum carb, platina, even elianthus is a very good remedy for tender thyroid gland. So, acute thyroiditis, this all remedies could be thought about. Talking about multinodular goiter, you can think about phytolacca, graphitis. Similarly, if you have a cervical lymphadenode, which are associated with the goiter, and if you could see that goiter is sort of infiltrating the surrounding skin, it has become immobile. Okay, with cervical lymph nodes which are palpable, we can also think of remedy like cystis canadensis. If the right now, sometimes the goiter could be uniformly enlarged, or it could be just a right-sided goiter, or it could be a left-sided goiter. Depending on that, also, you can decide the remedy. So I would be sharing the few clinical tips at the end. So that's why I was stressing the importance of clinical examination. Okay. So yes. Again, coming up to investigation, I've already spoken about thyroid function test, that is your TSH, FT4, and FT3, and why we need to check for free hormones and not total. In Hashimoto's thyroiditis, autoimmune thyroiditis, we need to look for anti-TPO antibodies or anti-thyroglobulin antibodies. And in Graves' disease, again, we need to look for anti-thyroid receptors antibodies. So these are more so if there are some patients, in practice, who want to know that what is the causes of my thyroid, and majority of them fall under autoimmune criteria. So you can do antibody test, and clinically for treatment wise, I feel it's not going to make a difference. But yes, to show an before after antibody titer, to get a clarification that yes, it is an autoimmune disease, you can do this investigation. USG net in cases if there is a goiter, and iodine uptake studies, which are an important studies in cases of thyrotoxicosis. What is the cause of thyrotoxicosis to find out? And in some cases, if you want to rule out malignancy, or you want to be sure that the goiter is benign, you can also advise for FNS. I just wanted to show this image from Davidson, which talks about thyrotoxicosis and the iodine uptake scan, which I just spoke about. So if you could see this Graves' disease, okay, in Graves' disease, the iodine uptake is quite high. So you can see the entire thyroid gland picture. If we see multinodular goiter, you could see immediately in a nodular form, the iodine is being uptaken. Toxic adenoma, there is a single nodule which is being seen, and it is very important for us to that we can differentiate from thyroiditis. Okay, thyroiditis, inflammation of thyroid gland, also presents similarly like a thyrotoxicosis picture, right? But how will you differentiate? Obviously, it's an acute phenomena. The patient will have a lot of tenderness over your thyroid region. Okay, so if you palpate the thyroid gland, usually in thyrotoxicosis, it is not painful, but the gland will be painful in cases of thyroiditis, transient thyroiditis. And if you do an iodine uptake scan, the uptake of iodine, if you could see, is almost negligible. And this will help us to differentiate it from hyperthyroidism and transient thyroiditis. And we see a lot of patients who come up with cough, cold, that is pharyngitis, laryngitis, with also tender thyroid gland, and they could be patients presenting with thyroiditis. So this is an image from of one of my patient with Graves' disease of this iodine uptake scan. So I just want to share. So this is how the iodine uptake scan will look if it is a Graves' disease. So this was a brief introduction about the topic, about the investigation and how clinically you can approach, and why clinical exam is so important. Most importantly, what we are going to talk today is about the homeopathic approach. So just wanted to clear that I'm still audible.
Yes, ma'am.
Okay. So if you have any questions and query, please write down in the chat box. I'll definitely answer it at the end. Now, coming to homeopathic approach. Now, so when I began my practice, okay, it was more of a Kantian approach where I used to take the entire case and it used to form a totality, giving importance to mentals and forming a constitutional totality and prescribing the remedy, which I still do in all my patients. But the main focus or main thing which I observed that the patients were getting better with this approach, but there were few cases and mainly pathological cases where I was somewhat getting stuck. That the patient, after a slight improvement, they were coming to an SQ or there was no further improvement. For example, taking as we are talking about thyroid. So if the patient who were presenting with autoimmune thyroiditis, so symptomatically the patient was better, but the goiter sometimes was not settling with the medicated constitutional medicine. So that's where I thought that there has to be something more for me to prescribe on, or there's thing which I am missing in my cases. And that's where my interest in Dr. Burnett's writing had come, and I read his literature, and it sort of inspired me to try this approach on my patient. And specifically, there is a pathological case, and believe me, the results are really amazing. So the book book on Dr. Burnett, that 50 Reasons for Being Homeopath, is an excellent book. I would recommend that everyone should read this book. And he has given a lot of insights about 50 reasons that why he believes in homeopathy. I hope majority of you must have read this book. If not, do read this book. And Dr. Burnett says a remedy which is based on totality of symptoms, mainly a constitutional remedy, relieves the patient, but it does not remove the diathesis and does not reverse the pathology. Pathology specific remedies can reverse the pathology but cannot treat the diathesis. Okay, and anti-miasmatic remedies or nosodes help in getting rid of the diathesis as well as pathology because they are prescribed on the basis of diathesis and pathology. So we'll understand this more. So apart, if you see in my approach, there are constitutional remedies which are prescribed, there are pathological specific or disease specific remedies which are prescribed. So, and there are anti-miasmatic remedies and nosodes which are prescribed. So, prescribing an anti-miasmatic remedy or nosode is very, very equally important in each case and specifically in endocrine case because he says it helps in getting rid of the diathesis and the pathology. So, what happens in the hypothyroid cases or thyroid cases that the patient gets better, but if there is some emotional stressor or there is some physical stressor after a few years, right, there are chances that the thyroid condition might come back, and this still can happen. But after we starting prescribing anti-miasmatic remedies and nosodes, the incidence of people coming back with the pathology, coming back with hypo or hypothyroidism after treatment has drastically reduced. So this is a sort of approach which I formulated, inspired by Dr. Burnett, that in thyroid or in thyroid, I give the indicated remedy similimum along with it if the case demands. So it is obviously patient centric. What it is a patient who not decides what remedy I'm going to give him, what is going to be my approach. In a case, you will find that I'm using all the three things. I'm giving a constitutional remedy also, I'm giving an intercurrent, a nosode also, an anti-miasmatic remedy also, and I'm also giving a disease-specific or pathology-specific remedy. Or in the case, I'm just using this too. So depending on what is the case, what is the pathology, I go around with the cases. So we'll talk about the cases now. So now if you see my cases, the remedies are really very simple. Even I feel you can guess the remedy when I'm telling the case, but it is more about how I approach it, and that is where I'm going to talk about and what I do if I get stuck in a case, right? And we'll start with simpler cases, and I'll share a few complex ones. So starting with the first case. So this was a 25-year-old female engineer by profession. She consulted me on 24th Feb 2022. Most of the cases are very recent, in which I'm going to share of past 1 or 2 years. So she approached me for recurrent boils, and she used to get this boils in axilla and her left side axilla, pubic area, and this is going on and off since 10 years. She used to get mild discharge, which was yellow, mild bleeding from this boils, and there was itching around the boils. So the cases are going to be in brief. They are not. I'm going to share the characteristic symptoms in the mind and general as we go ahead and see. Second complaint which she came up was with cough. So this cough, which was very a non-specific symptom, to be honest, this was mainly related to an allergic issue. So on and off, she used to get this cough with some sweetish expectoration. Then she mentioned that she was diagnosed with hypothyroidism 1 year back, and for that she took some homeopathic combination medicine the name she doesn't remember, but she took it just on her own from a local pharmacy. But it did not help her much, so she stopped it within 1 or 2 months. The symptoms, the symptoms which she had due when she got diagnosed with hypothyroidism and which are still persistent are hair fall and irregular menses and weight gain, because of which she got herself tested and she was diagnosed with hypothyroid. I'll show you what were the TSH value. Now, talking about physical generals, in her craving, she used to like sweets a lot. Perspiration was often seen, axilla. Sleep was disturbed, and she used to get dreams of falling. Menses were scanty, and thermally, she was chilly. Now, this is an important slide for us to understand the miasm of the patient also. And so I also focus a lot on the past history of the patient and the family history of the patient. So in the past history, she had typhoid. And after that also she mentioned that, there was some disturbance and she had started gaining weight. She started with hair fall because of her typhoid issue, post typhoid issue. She also had urticaria, but now since few years there are no episodes of urticaria. Mother was hyperthyroid. She also had eczema, and father and uncle had diabetes and MI in the family. Now she was a very anxious person. Now when she came to the OPD also, she was extremely anxious, hypochondriac, like too much anxiety was present and all aspects, specifically related to health also. So she was really seeking something that would, take care of her hypothyroid. She was not getting results. She was gaining weight. Skin was getting pigmented. So because she was very anxious and she was asking a lot of questions related to that and what should I do. Then she said this anxiety is there since childhood. Like whenever she has to perform, so in a stage performance, there was to be a lot of palpitation. But she used to, she was able to perform, but there were a lot of overthinking. And when now she's working with a startup firm, and so anytime she has to present something, there was a lot of anticipation and a lot of anticipatory anxiety. But yeah, she was able to do her job well. And the way she was talking, she was continuously, her speech was, she was going on and on and on, and the speech was very hurried. That is what was my observation about her was that her speech was very hurried, and she had a sort of fear of closed spaces. So as I said, the TSH was 16. So she came to me in February 22, and the TSH value, so she had done only her TSH, T3, T4 she had not done. So TSH showed that it was 16. Normal TSH value is 0.5 to 4.5. Some lab writes the range of 5.5 also, but usually it is 0.5 to 4.5. So, and this is definitely overt hypothyroidism. It has gone above subclinical stage also because the TSH is about 10. So, this is a case of diagnosed hypothyroidism with bacterial skin infection, right? Now, talking about prescriptive totality and the remedy which I had prescribed her. Again, the remedy was, as I said, very common remedy, and which the simple remedy showed excellent result in our case. Okay, so this is what my repertory sheet looked like. Anxiety, health about one's health, hypochondriacal, fear of narrow places, anticipation anxiety, stage fright, dreams of falling, sweet desires, and personal history of boils recurrent. All right. Now, from this, the remedy which I prescribed her was argentum nitricum. Though lycopodium is coming first, I'll share you why argentum nitricum was prescribed. So, before this, I just wanted to show you the follow. So, after along with argentum nitricum, okay, I had prescribed her calcarea sulf 6. If calcarea sulf 6x was a biochemic combination, which was prescribed her for her recurrent boils, which she had complained of. So it was recurrent bacterial skin infection, so for which I had prescribed this. Later on, if you see, the patient was getting better. The cough was better. Boils were somehow remain still. So after a month, again I repeated argentum nitricum, right? Where again all the symptoms, cough improved, her hair fall had improved, but the symptom of boil, okay, was somehow not responding. She was getting new boil in her anal region, which was itching and burning. So that was a point where I thought I need to give something for her boil because they were not responding to calcarea salve as well. So I was thinking of a remedy called staphylococcus, right? So staphylococcus is a remedy which is given for bacterial infections, and the recurrent skin boils which were getting usually they were because of staphylococcus aureus, which is a common pathogen. So that was my thought to give, and or otherwise an intercurrent remedy like a thyroidinum. So a nosode or thyroidinum, an intercurrent remedy was my thought to prescribe here. So before I thought first, let's begin with thyroidinum and see how her response is. If she doesn't respond with thyroidinum, I will switch to staphylococcus. So now again, people think that if it is a case of thyroidinum, thyroidinum has to prescribe, but that's not true. I don't prescribe thyroidinum in all the cases of hypothyroid. I use it as an intercurrent remedy or a drainage remedy in few cases, and there are few indications of using thyroidinum, which I will share definitely at the end. In this case, why thyroidinum was chosen as an intercurrent remedy is if you observe, okay, that she has a family history of allergy. That mother had eczema, she herself had urticaria. She has a family history of hypothyroid. Okay, she likes sweets. She's a chili patient. So these are few indications for me to use thyroidinum as an intercurrent remedy, and that's what used in this case. Then the last thyroid report which was done was in December 21. So I asked her to repeat her TSH level, and here if you see the TSH from 16 had come down to 4.9, which is in absolutely normal range. Okay, and the boils were also started responding. So I did not intervene with staphylococcus. I later on she had come. She used to take a lot of break. So in between, she came after a long break where I prescribed argentum nitricum 1 m. Again, I stepped up the potency, and in November, the TSH was repeated again, which was still improving. It was still under normal range. Okay. So in December and Feb, what was happening in Feb 23? Okay, she was getting married. So her anxiety had peaked up to some another level. Like, she was also getting a sort of panic attack. It was a love marriage, but still, sort of was going into panic attack. So I changed the remedy. I stepped up the potency to 10 m twice. In spite of giving argentum 10 m, what happened in April? So just in April last month, I saw her, and okay, there was entire change in picture totality. So what she said that lately she is getting a lot of anger, outburst of anger, so much that once she had hit her husband in anger. So she feels very much overburdened now. She's feeling that she's not married and she has to behave in a particular way. She has to get up early and all these things. She has to do household work. And I said, and I asked her like, what family setup do you stay in? So she said, majority of time it is a nuclear family. Sometimes the in-laws come up, but majority of time is it is only the husband and wife. But in spite of that, I said, then why are you so overburdened with work? She feels no. What if what will people think about me if I don't behave in particular way, if I don't get up, if I don't do the household work? What will people think about me? And that is the time. This time I changed the remedy from argentum to staphylococcus, right? So I just want to focus one aspect here is that as the symptom picture changes in our practice, we need to change the remedy. We cannot just stick on to the original remedy or the constitutional remedy which we gave. Maybe staphylococcus is a phasic remedy. This will help us to bring about some new symptomatology in her, which would guide her to another remedy. So be open in changing the prescription as the symptomatology changes. And this is what our stalwarts have been doing. If you read a lot of lesser writings and you observe that as the symptomatology changes, the remedy was changed, right? So another aspect, why argentum nitricum, why staphysagria, and what are the other aspect I'm looking up in this case, I just wanted to share with you. So another thing which another remedy which I'm thinking in her case is to prescribe is soranum as an anti-miasmatic remedy. And why soranum? As I mentioned, okay, so layer by layer, you need to remove the miasm which is responsible for these. So here, as I showed you, there was a past history of typhoid, and this past history of typhoid has somewhere disturbed her body, because after typhoid also she mentioned that she had started with hair fall and started gaining weight, right? And if you go to repertory, this is kitchen. Usually it doesn't take so much time. I don't know, there's something wrong with the dart. So I wanted to show you generalities. Yeah, convalescent. During typhoid fever after. Okay. So never well since typhoid. You have soranum as one of the remedy which we can use of anti-miasmatic remedy which we can use of. So my plan of action, as the case progresses, I am going to introduce soranum in between as the case demands. Another thing, yeah. Argentin nitricum is a very, very well-proved remedy, polycus remedy. I just wanted to show you the hysterical nervous people, okay, hurried speech which is there uh, in argentum nitricum which is mentioned. So nervous, impulsive and hurried people, okay, yet timid and anxious. So this is the picture in short of argentum nitricum, on basis of which I prescribed her and other symptom totality. Now, staphysagria, I had obviously taken rubrics also when I changed it, but I just wanted to show you that exactly how the patient narrated, the same thing is mentioned in materia also, right? So, violent outburst of passion, okay, which is there a lot in her. Okay, snappish, and there is a sentence. Very sensitive to what others say about her. Okay, so she's very sensitive about what will people think about her, what will people say about her. So these are the indications on which I changed this to remedy. All right, and as you saw, the patient is getting better. The thyroid levels are still normal, but we just need to sort of clear the diathesis, the miasm, and after that, maybe after few months, I'll ask her to stop the treatment once I feel that her mental stressors are in such a position that she can handle it. So in this case, the approach was to prescribe the indicated remedy and an intercurrent remedy when the set of symptoms remain acute. And when the symptom picture changes, the remedy needs to be changed. Now coming to the second case. So this is a case of a 50-year female. residing in Kandivali. She's a housewife. Again, she visited me on 7th March 2022. So she's a known case of hypothyroidism since 2010. The the first case which I mentioned, she was not taking any external thyroid medicines, but she was taking Thyronorm 100 micrograms. And in spite of taking Thyronorm, her TSH levels were fluctuating. She complained, the complaints which she had because of thyroid were she had weight gain, which was a gradual weight gain, and she used to feel that her entire body is swollen. There was somewhat swelling all over her body. There was mild hoarseness in her voice and pain in joints and pain in soles. She said that she also suffered from menstrual irregularities in the beginning. Now she is menopausal, but she used to suffer from a lot of menstrual issues. So pain and soles was something which was also disturbing her. Okay, they were and it was so much that even touch used to aggravate her, and she was very sensitive to touch, specifically on her soles. And there was also head pain which was disturbing her. In August 2019, she suffered from some kidney issue. Now, what was the kidney issue? She did not have any reports, or she just remembered that she suffered from some issue, and that time the kidney functioning had gone to 10%. But at present, she is not taking any medicine. So maybe it was an episode of AKI due to some disease which she is not able to recall, or she doesn't have any reports about it. So talking about her generals, she again she had a craving for sweets. Thirst was scanty. Then there were dreams which were of suffocation. Thermally, the patient was chilly. She's sensitive to draft of cold air, and there's a lot of tendency to catch cold because of the cold air. Is there any issue with my voice?
No, ma'am, there was somebody who had done that.
Okay, okay. All right. So, and she was an obese patient, mainly because of hypothyroidism. Now, mentally, she did not have much characteristic, but and she was a housewife, and the entire family was revolving around her children, and she was a lot of anxiety about her children, about their health, about the husband's health, because he was also not keeping well, and she usually used to stay at home, and usually she wants someone to be present with her. Now, if you see the thyroid levels, okay, this is something which I was also a little shocked by seeing. There is a lot of fluctuation. As I said, she was taking altroxin or Thyronorm 100 micrograms. In spite of that, also if you see the last TSH value is 224. Okay, sometimes here in 2012 she had gone into hyperthyroidism. Then again, this are a lot of hypothyroid, but there is a lot of fluctuation. So, and depending on her reports, the thyroid dose was sometimes decreased, then increased, and this was continuously going on, right? Yeah. So the prescription, first prescription which I made in her case, okay, was tuberculinum. Now, why tuberculinum? So you saw the erraticity of her thyroid, what is happening to the thyroid gland. Okay, right from point 6 to 140. Okay, just in the span of 5 to 6 months. Again, in the span of 6 months, it has gone to 224. There's a lot of erraticity of complaints. So tuberculinum, if you see, when symptoms are constantly changing and when well-selected remedy fail to improve and cold is taken from slightest exposure. If you see also in repertory, symptoms which change constantly, tuberculinum is one of the remedy mentioned by Dr. Fata. So this is somehow tuberculinum helped me to bring down the miasm which was causing such erraticity of a thyroid gland, and this helped me somewhat to to stabilize or normalize the gland. So this was my anti-miasmatic prescription, but yes, I have to give a okay. I repetize dose. So dreams of suffocation, anxiety, family, sweet desire, okay, pain, head pain, air draft, aggravate, change of symptoms. All right, and depending on that, okay, the remedy which I was thinking was calcarea and kali carb. So calcarea carb or kali carb. So in her case, I prescribed kali carb. Now kali carb more on her generalities. Okay, tendency to catch cold is present in both because both has carbonic element, but the sensitivity to the feet. Okay, she mentioned there is a lot of sensitivity in her feet and soles. And if you read kali carb, okay, the sensitivity of the feet or soles to touch is very marked. Okay, so much that even the overall they're very sensitive to touch, Kali patients. Even Kent writes very beautifully about sensitivity of feet in Kali patients. Plus the anxiety about the family. I prescribed Kalika rather than Calcarea, and I went in this case. I went to LM potency because the pathology was such and the thyroid gland was as such a state that I wanted to repeat the indicated remedy, and the better way to repeat the indicated remedy is LM potency. So I started with 0/1, and then I stepped up to 0/3, and the last Kanika potency shown is on 0/5. Okay, so I just wanted to share the thyroid results here. So if you saw the last in 21, December 21, the thyroid was 224, right? And every time there was a lot of fluctuation. So in her case, I wanted to do the TSH levels every month. And here I want to mention that she was taking altroxin, but after the first follow-up, okay, where the TSH came down to 43, again the normal value I want to focus is 0.5 to 4.5. I asked her to make the dose of external thyroxine to 50, so from 100 to 50. And every month I wanted her to do her thyroid levels for few months. Pre-T4 and T3 I wanted her to do once, which were in the normal range. So coming here, so if you can see in April the thyroid was TSH 34. In May it came to 16, and for a few months there was again a gap. Patients usually when they are better, they don't tend to follow up. But I had taken a phone follow up in December last year, and she mentioned that she's doing better. Okay, and symptomatically better. And she just checked her TSH level in November, and it was 8. And so I sent her this time carb 0/5. Okay, and I'd asked her to repeat her thyroid and come back to me. And this time I asked her to make her altroxin dose, which was 50 to 25. So I'm sort of tapering the dosage now, and maybe in the next follow-up year, even if I wanted, I could have stopped her altroxin, but I just wanted to make it to 25 for maybe a month more, and then maybe next month as the thyroid comes or gets better, I'll stop the external altroxin completely and keep her on homeopathy for more 6 to 7 months before I stop her treatment. Okay, so she is still not come for follow up, but I'll have to follow up and see how things are with her. But she usually, that's a tendency that she skips treatment in between for 2-3 months, and then she will come back for follow up. So this was the approach in this case. Now another thing, that to prescribe the anti-miasmatic remedy, so that's why I was stressing the importance of miasmatic background and to prescribe on the miasmatic background, and how I feel tuberculinum played a major role in this case for me, and for the case and for the constitutional remedy also to act on, right? So anti-miasmatic remedies really help to remove the tendency and diathesis, and we need to use this very often. In this case, okay, though I have not mentioned, but later on now I have also put on thyroidism 3x, a sarcode as a drainage remedy, because she has few symptoms which were persisting, like the weight gain, okay, was a problem. So if you see there's a lot of swelling in her body, which she mentioned, the weight gain, tendency to catch cold. Again, these are indications of thyroidism, but in this case, I had given it in a lower titration, 3x potency repeatedly, BD, which is going for almost past 2-3 months now. So this is the second case where I wanted to focus more on anti-miasmatic approach. Now coming to the third case, again a simple case with a very simple, very common remedy. So she, 35-year female, visited to me on 20th Jan 2021. Again, known case of thyroidism since 4 years. Now, sometimes majority of patients now, because this L-troxin has to be taken daily, many patients are not compliant to it, and even she was one of them that she took the medicine for 6 months, and she said that many a times because of my work or housework with my children, I tend to forget it, which happens in majority of females. And she's like, who will take this medicines lifelong? So that is the main concern of majority of patients, and that's why after a few months of consumption of Thyronol, she just the medicine, and she was not taking anything when she came to me. So why she came to me, that again since few months, okay, she started complaining of weight gain. Okay, weight gain which was very significant, and there was one symptom which was persistently she's complaining of, was of breathlessness. Okay, she used to get breathless, suffocative spells specifically at night, and because of which her sleep was disturbed. Okay, and irritability, a lot of mood swings were increasing these days. Talking about physical generals, hunger which she couldn't tolerate, she likes preferably little salty food. Perspiration was offensive, particularly on upper lip area. Okay, menses were also irregular. They used to be delayed by almost 50-60 days, so their cycle was about every 2 months. Menstrual flow was also offensive. Okay, leukorrhea, which was also offensive. All right. So just keep into mind that discharges are very offensive. Thermally, she was an hot patient. Now, mind what was there? There was a lot of separation. First of all, she stays in a joint family with her, in-laws, brother-in-law, and brother-in-law was a person who was sort of used to abuse her physically. She was an alcoholic, and sometimes he used to hit her also, and so that was creating a lot of anger towards the brother-in-law. Okay, so there was a lot emotional anger, and she used to feel that sometimes this anger is going to come out and she's going to harm that person, and that's why that's something she used to think a lot about. And thinking of that used to make her cry, and there was a lot of weeping, specifically when she was alone. Okay, and that's why, because of her state, she used to feel that the children should be educated, and so that they are independent and they will not suffer because of me. So that was her mental scenario. TSH, again, okay, she came to me in January 21, and she had just done a thyroid report in December where the TSH was 15. She had done total T3, T4, alright, which were in normal range, but TSH was 15. Again, primary hypothyroidism. Okay, the remedy, as I said, is a very common remedy which I prescribed her. Weeping, alone when emotion suppressed, salt desires, discharges, offensive, hunger, aggravate. And the remedy which I prescribed her was natrium mute. Okay, so here again I want to focus on more, see how first prescription was natrium mute. She was better, alright. I repeated the prescription in the month of February, She came after a break after 2-3 months where there was some stressor in the background, and okay, that caused disturbed sleep, and there was irritability. So I stepped up the potency. All right. So here also she was feeling overall better. I asked her to repeat the TSH, and as you can see, the TSH from 15 had come to 8.94. So there was an improvement in her TSH value. So what was happening? All her symptomatology, that sleep was better, okay, irritability was better, but the only symptom which she had come in between was not getting better to an extent. In between, it was better, but again and again, it used to come up. That there was a breathlessness, there was suffocative spells which were present, okay. And if you see, okay, this is where I shifted to spongia. Now, spongia is a very good remedy, okay, respiration asthmatic accompanied by goiter. So that's why I'm trying to say that use this associate remedies with your diseases, and it will help you to sort of, go towards cure. So after spongia, okay, her breathlessness significantly improved. Like she if I asthmatic accompanied by goiter. Okay. So there is only one remedy, respiration asthmatic accompanied by goiter, again given by Dr. Phatak, spongia. Right. So this suffocative spell, which were present, and breathlessness, which were present at night, which were persisting, which were not responding even to natriumute, and that's why I sort of changed with spongia 30 TDS for 15 days, and with spongia she was better. Here in December, we again did her TSH and it had come down to 5.33. All right. And she was not taking any thyroid medicines, only with homeopathy again. And here was the time where symptomatically she was better. All right. And I need to address her diathesis, I need to address her miasm. And that is why I was telling in the beginning that discharges offensive, right? Hypothyroid case, okay, weight gain, thermally hot patient, all directs towards psychotic miasm and symptoms of psychotic miasm. That's why I prescribed a medorinum 1 and 1 powder, right? So in this case also we thought there is a constitutional remedy which indicated remedy. There was a pathological specific remedy. So importance in learning in this cases, importance of associated symptoms with our thyroid disorder while prescribing. That is what we need to give importance to. And if you're getting stuck with those symptoms, give those symptom importance. Look what are the remedies and prescribe on that. Coming to the next case, this was also a very interesting case. So this is a female, 33 years female who visited to me last year in April. So she complained of breathlessness, okay, breathlessness which was there since 1 year, and this breathlessness started after completion of her tuberculosis treatment. So she had a very bad tuberculosis. I'll come to it, that she had port spine also, and she had pulmonary tuberculosis also. And pulmonary tuberculosis was MDR tuberculosis, for which she almost took treatment for 2 years. Alright, and she has also undergone surgery twice for a port spine. So it was a very bad situation. She said she has almost come back from deathbed. That's what the patient told me. Her condition was very critical. So post she completed her tuberculosis treatment, she is feeling breathless. Okay, and so breathlessness was present, and after tuberculosis she has developed hypothyroidism, and again she is not taking any treatment for her thyroid. Along with that, she also had acidity, which is present since 1 year. There were adaptations which aggravated empty stomach. And she said since she has stopped her tuberculosis treatment, she has not got her menses. Okay. So there is no menses for 1 year, and there's a lot of weight gain because of that, joint pains which is present because of that. Generalities, cannot tolerate hunger, and she specifically likes cold things. Okay, there is a lot of desire for cold and cold water. She says that she'll specifically only drink cold water. As I said, that she had pot spine for which she was operated. She also had pulmonary tuberculosis. If you see the family history, alright, family history, the brother had tuberculosis, mother had tuberculosis, all right, and father expired due to organ failure. Mental sphere, if we talk about, okay, so again, she used to say in a joint family, there are a lot of stress in a family going on. That is making her more irritable. Okay, so again, her emotions are basically suppressed. She mainly is not able to express what she feels when she is angry. Very emotional, very sensitive to people, what people say about her. Okay, there are a lot of things which are going up in the family, but she says that she prefers to keep all the stress to herself. Okay, and because of her illness, okay, the family what has blamed her for 2 years. She was almost, not able to do a lot of things, and all that disturbance is present in her mental state. Okay, again, she came to me in April. She had a TSH done in the month of March, and if you see, TSH was 42, which is really very high, and she had some fibrous changes in her lungs post her tuberculosis treatment, right? So that was persistent. So anyone now, because I have shared a few cases, anyone who would like to say anything about the remedy, you can write up in the chat box. Again, the remedy is very common, very simple. Quinta, if you could tell me if there are any remedies which are coming in the chat box.
We have a suggestion of sepia.
Okay. Right. Anything else? Okay, we'll go ahead. Okay. So yes, sepia is one of the potential remedies which even I thought for in this case. Okay. So now again, my first prescription here was more of anti-miasmatic. The first prescription here was Drosera. Now why Drosera? Okay, if you see, again I'm saying associated symptom. Okay, what is the symptom which is present in our case, which is present with hypothyroidism, is very important for us to prescribe on, right? If you refer repertory, okay, external throat goiter, exophthalmos, tuberculosis family history with you have Drosera as the only remedy. If you read Drosera from Margaret Tyler, you will see she has beautifully portrayed about tuberculosis, okay, and use of Drosera. So in this case, as you saw, there was so strong family history of tuberculosis and personal history of tuberculosis. So I'll just read tuberculosis disease, glands and bones, tuberculosis manifestation or a strong family of history of tuberculosis put up a strong plea for the consideration of Drosera in any disease. Other influence of Drosera, glands of neck, if they have to produce only very small openings, all suppurating glands soon in size and close. Okay, old cicatrial tissues heals and softens, deep tied down scars relax and come up. So the deformity is greatly lessened. So Drosera is one of the remedy which we need to think about, where there is strong family history of tuberculosis, right? And after 15 days, I called her, okay, the menses, okay, which were absent for 1 year after the medicine, after the Drosera, okay, she got her menses after a year, and the flow was better. It was comparatively scanty, but she was really very happy. And when I was happy, because to be honest, I was really surprised to see this result within 15 days of the medication. And the breathlessness which she had was also better by 60%, right? Then I shifted to her constitutional remedy, which was Natrimure. I prescribed for her again, taking into consideration her generals, and mentally there was not a clear picture which was there. So I relied on general and I prescribed Natrimure, very good remedy for hypothyroid per se. Then Natrimure was given, all right, and I asked her to repeat her TSH. Okay, here the TSH, if you saw, was done in March. For a long period, she had not done her TSH. So we did her TSH in December again. And from 42, it had come to 14. Again, she was not taking any other medicines. TT, T4 were again in normal range. Okay, symptoms, she came after a long period, okay, long interval. So the symptoms were almost same. So I prescribed again the same remedy, Natrimure. Okay, what happened when she came in Jan? That she said that the breathlessness was better, but the menses were again absent for 4 months. Okay, after the first prescription followed by Natrimure, she was regularly getting her menses, but she has again skipped her menses for 3 to 4 months. Here, I again gave Drosera as an intercurrent remedy, take into consideration that there has been some diathesis or miasmatic background which is still remaining because she had such a bad episode of tuberculosis, okay, that it requires more repetition of Drosera. So I here prescribed Drosera again, and then she came back to me in March, and she mentioned that she had got her menses in March. The breathlessness was better, and overall she was feeling better. So another thing in this case is that in giving importance to miasm or anti-miasmatic remedy, Drosera falls under tubercular miasmatic remedy, prescribing intercurrent remedy. Here, after the effect of Drosera is and the tubercular miasm is somewhat getting better, I am going to prescribe the next remedy which is going to come up is Medorinum. Now, why Medorinum? Again, there are characteristics of Medorinum or psychotic miasm. The craving for cold water was a lot in the case. Okay, and if you read Medorinum, craving cold things, again, obesity, thermally hot, which and characteristically points towards Medorinum. So once this symptomatology of tubercular miasm is getting better, I am going to require Medorinum in this case also. Right? Now, coming to the next case. Now, this is a very short case, and here I'm going to focus more on the symptoms of this case. Okay, so just a minute, yeah. So here, this is a case of a 29-year-old female diagnosed with hypothyroidism, and she's taking Aldroxin 15 micrograms. Okay, but main concern was, okay, and her thyroid levels were also normal. The main concern that she had was that in spite of this thyroid being normal and she being taking Aldroxin, she was experiencing swelling in the body, okay, and she had a significant weight gain. So when she came to me on 4/8/22, her weight was 110, and she said after a pregnancy, a first child, she is gaining weight, but now the weight is significantly gained, and she feels as if her entire body is swollen and the entire body is bloated, and she also had mild goiter which was present. So these two things were something which were not responding and not getting better in spite her thyroid levels being normal. All right. She also had some acidity issues. Okay, and menses used to be regular, and the swelling was used to get slightly better with her menstrual flow. Also, past history, family history, there was nothing significant. Only thing that she used to recurrently get cold, okay, and throat infections. And as I said, the weight was 110.6 kgs. So in this case, okay, I moved on to thyroid 200 in infrequent doses and had prescribed fucus vesiculosis 3x, 10 drops twice daily. So if you could see within 1 month, okay, she had lost 4 kgs of her weight. So the bloating and the swelling which was she was feeling, it was much better. At present, the weight has come down to 103 and it is stable at this level. So whatever the bloating and the abnormal swelling which was present, that was sort of brought down by thyroidinum and fucus vesiculus 3x. Now, why fucus? Okay, if you read fucus from Borix Materia Medica, you will see you'll understand that thyroid enlargement in obese subjects. Okay, it is one of the specific remedies to be used for this. Along with this, patient also have a lot of digestive issues. Okay, problem, a remedy for obesity, non-toxic goiter, and also exophthalmos. Okay, so it is one of the useful remedy to be used for swelling or obesity in thyroid patients. Thyroidinum again, because the aspect of swelling all over the body, tendency to catch cold, I have used thyroidinum as in infrequent doses and fucus regularly. I just wanted to share you more about fucus vesiculosis. Okay, it is an excellent remedy to be used in exophthalmic goiter or in cases of goiter. And I would like to share cases from our masters. So after treating many cases of exophthalmic goiter, I have come to the conclusion that I have found a specific for that disease in fucus vesiculosis. Okay, I might recommend you one of the case. Mrs. Mary B, age 24 years, German, came to my clinic at Brooklyn, homeopathic dispensary, to be treated for a swelling in the neck for several years of duration. I gave her the tincture of fucus, 30 drops 3 times a day. The treatment began on December 1, 1895, and the patient was discharged and cured in October 2, 1896. So within a year, the swelling was absolutely gone. Would be pleased to hear from any others who have any experience with fucus. So he says that charcoal of this plant has long and had a reputation of a deobstruent and being given in goiter and scrofulous swelling. At all events, I was led to try this remedy in pronounced cases of goiter with such good results that I never since given any other remedy for that disease, either in the exophthalmic or in a complicated form. And he mentions that I have never known it to fail to cure when the patient was under 30 years of age. So even he has mentioned, so this is the reference from which I have in this case. So he has even mentioned that below 30 years, fucus vesiculosis acts best. Even if you refer repertory and if you see thyroid enlargement, okay, obesity with, you will find fucus as the only remedy. So fucus vesiculosis you need to use in your practice if you have patients with goiter, okay, and as he mentioned, below 30 years of age and exophthalmic goiter or any other goiter along with obesity, you can use this remedy. Now coming to the last case, already 340. Okay, so I'll just summarize. I'll just go a little bit fast because I want to keep some time for questions also. So this is the case. Now till now I've been sharing cases of hypothyroidism only. So this is a case of thyrotoxicosis. Okay, and this is a very recent case which I saw on 17th April 2023. Now here the patient was diagnosed with hypothyroidism and diabetes mellitus in June 2020, and there was a history of losing weight, and that is why she got herself investigated. At present, she is taking neomocosol 10 mg BD, and so she had this complaint of weight loss, trembling, a lot of other symptoms for which she was consulting some other homeopathic doctor. because of which the symptoms of weight loss and trembling she mentioned are better, but her thyroid levels are somehow not come back to normal in spite of taking treatment, and she still feels there are a lot of swelling in her joints, there are pain in the joints, and there is edema on her feet, and which even I could see there was slight eczema which was present on her tibial aspect of her bone, and she also had a swelling. Okay, she had a goiter which was palpable, and so this was a case of thyrotoxicosis or hyperthyroidism with toxic goiter and diabetes mellitus. So she presented with exophthalmos. Okay, I appreciate her exophthalmos. So there was a lot of swelling around her eyeballs. As I said, because of the treatment with other homeopathic doctor, her trembling and symptoms of weight loss were better. All right, but this exophthalmos has been persistent. So I asked her that how all this started. So she said that she was a beautician, and during lockdown, what happened? Because in 2019 and 2020, that is where the COVID-19 pandemic stuck, and because it was a personal business she had, and she was renting a place, she had to shut down her business, and that took a lot of toll on her savings. Okay, she had to save all her gold ornaments and a lot of things. Okay, and the husband doesn't have any stable job, so she was the sole sort of bread earner in the family, and all the responsibility was basically on her, or mainly she used to feel that. The husband, I spoke to the husband was quite okay. He mentioned, no, financially we are okay and we are coming back to track, but she was no, she was like that, all the responsibilities on me, and if I don't work, what will happen of my family? So that was something which was there in her. Okay, I'll just go through the generalities, few things as you can see on the slide, like sweets, dreams of water, perspiration on face. So TSH here, I would like to say that it is 0.01. So 0.01 is less. Okay, and her free T4 values were also increased. So this is a proper case of thyrotoxicosis. And the fasting blood sugar is also increased. Postpartum is also increased, and HbA1c is also 7.9. So for both of this, she is not taking any other medicines. She was taking homeopathy, which she has stopped now earlier, and she's not on any OHA that or anti-diabetic medicines. But yes, she is taking neomeprazole, which has been continued till that. But neomeprazole is also not helped to bring back this thyroid levels to normal. Okay, so I had shown a scan of thyroid uptake initially on the beginning slide. Was this that was of this patient where she had a diffuse toxic goiter. Okay, family history of CA pancreas, mother had ILD, sister had diabetes and hypertension. Okay, so these are the slides and these are the list of remedies which are coming. What I found characteristic in her, or not characteristic, which were short for me, right? That she desires sweets, she was taking a responsibility too strongly, the dreams of water which was there. I took those and I looked through the browse through the remedies. I was still not satisfying. Okay, I was still very confused and to should I prescribe as Natramune was coming in the first, but she did not look like Natramune patient, and I was confused with sepia, kalika. I was confused. Should I? No, I should prescribe Calia Floor, business paper. So I was a little confused with this patient, and then I saw this rubric. Okay, as I said, I tried to associate or find an accompanying symptoms which help me to give a clarity. In this case, I was thinking more of Kali group, okay, because of taking responsibility too seriously, okay, and revolving around again the family issues. And if you see this generalities, okay, if I show a rubric, diabetes accompanied by hyperthyroidism, okay, again given by Dr. Shankaran sir. diabetes, by hyperthyroidism. Okay, there is only one remedy, that is Kali iode. And as I was thinking in lines of Kali, I thought better shift to Kali iode, as she had also a significant goiter, and Kali iode is one of the excellent remedy to be thought of in cases of in hyperthyroid cases, right? And again, in this case, I have not mentioned follow-up, but I called her after 15 days, and symptomatically she was much better. Okay, I could appreciate the swelling of her eyeballs, around her eyeballs were reduced, the swelling of her body was reduced, and the pain which she had on her in her heels, she said the pain is absolutely. So I described her SL, and so this was the last case. Now I'll purely quickly run through therapeutics. Twinda, just let me know that how much time I have more, so that I can take few questions also.
Ma'am, it's 3:50 now. I think we can little overshoot the time to take the questions. That's fine.
It's okay, right?
Yes, ma'am.
Yeah, I'll take 5 to 10 minutes in this, and maybe then we can take the questions. All right. So as I was telling, indications of thyroidism, where you can use, in which cases you can use, right? So I just had to mention a quote mentioned by Dr. Farooq Master, that he says that never give thyroidism as a routine or specific for all patients who come with thyroid problems. So as I mentioned that we often think that if you do not understand anything, we are going to land up giving thyroidism either in 3 years, in 6 years. Yes, definitely it will give results to some extent, but that is not going to be persistent in all cases. So in which cases you should think about thyroidism is whether history of allergy, personal or family history of allergy, diabetes, goiter, any wasting disease, history of preeclampsia in mother, any history of disappointment in love, okay, marked sensitiveness to cold, tendency to catch cold, hypothyroidism after acute diseases. Okay, if you read Boric, if you refer repertory, thyroidism is one of the only remedy mentioned. Obesity, desire sweet, thyroidism can be used in ascending potencies 30, 200, 1M to regulate the growth of the body. Okay. We might also have accompanying symptoms like puffiness, obesity, rapid pulse, nausea, weakness, anemia to prescribe thyroidism. And these symptoms, okay, like for example, mania, delusional insanity, climacteric symptoms, which are associated with some derangement in thyroid gland, you can think about this remedy. Again, thyroidism, it is mentioned in books, it is more indicated in young patients than old patients. And it is mentioned that we need to continue this remedy for a little longer period to see cure. In young patients, in children also can use thyroidism with good results. Another remedy, okay, for goiter specifically is lapis alba. Now, the characteristic I mentioned, the swelling of lapis alba is soft. Okay, I just wanted to mention that Boric writes that the gland have certain elasticity and pliability about them rather than the stony hardness. So if there is a stony hard swelling of your goiter, you could think of remedies like bromium, spongia, cistus, calcarea floor, right? But if you feel that it is a diffuse swelling, bilaterally symmetrical swelling, and soft swelling, you have to and you can use lapis alba. And I have used in one of my patient lapis alba, was not responding in per se to the goiter, to the indicated remedy. And there is a case is also mentioned about lapis alba, where he writes about its use in gland where both halves of the gland seem to be equally involved. We can use this remedy, right? He has used lapis alba 6. Okay, coming to Lycopus virginicus. Now, this is the remedy where you now again talking about associated symptoms. So this is the remedy which you have to think about where there are associated symptoms in relation to heart. So if the patient has some heart pathology associated with your thyroid, or he might have a hemorrhoidal bleeding, you need to think about lycopis. There are some other remedies also which you need to think about. So I just wanted to show, okay, if you read lycopis from Boric, okay, um, okay, beneficial in toxic goiter associated with heart remedy associated all this. I wanted to show you the relationship. Another remedy which is mentioned in relationship to lycopus is Ependra. Okay, Ependra is another remedy which we can think about in exophthalmos goiter, where the eye symptoms are very prominent with association of heart symptoms. Okay, if we go to repertory, there are many other remedies. Cactus is another remedy. Okay, cactus is one remedy where you can think about where you have heart symptoms associated with toxic goiter, with palpitation. So if someone comes up with disappointment in love, okay, we usually think remedies like natrimure, but after disappointment, if he develops palpitation, heart symptoms, he comes up with goiter, if he comes with thyroid complaint, cactus is one of the good remedy to be thought of. Just wanted to show you about the associated symptoms. So I'm using synthesis. We come to ophthalmos. Accompanied by heart complaints. Okay, if you see there are a lot of remedies. Lycopris I spoke about. Okay, I spoke about Ependria. I spoke about cactus. All right, there are a few more remedies which are being mentioned in the repertory. So you can use those symptoms and in cases where you are stuck, in cases where you want to uh, look up or you have to treat those specific symptoms. Another remedy is amyl nitrosum. So this is a remedy where you have ailments from grief. Now, usually, if we see ailments from grief, we use remedies like ignatia, natrimure very often. But exophthalmos goiter or thyroid symptoms, if someone develops grief, all right, amyl nitrosum is one of the remedy which is mentioned in our material, mentioned in our repertory. So we need to use this remedy, okay, to see and get results, right? So another indication of use of amyl nitrosum is development of thyroid issues at climacteric period. So someone who is into postmenopausal period, who develops thyroid issues, you can think of using amyl nitrosum. Another remedy at climatic period which could be thought of is even lachesis, right? Which could be thought of. Okay. So talking about associated symptom, I just wanted to share another case which rather than sharing case, I will just show the rubrics. So I had a female, okay, who mentioned that uh, she was having goiter, she was having hypothyroid since many years, and she mentioned that she was getting joint pains, and that was troubling her. Okay, she was in her 50s, and this joint pains, she said, now before her during when she used to get her menses, the pains sort of used to be there during her menses. That was troubling her, and now also every time she said whenever that point, whenever the time of a menstrual cycle comes, the pain increases. All right, and the goiter she mentioned was also painful before her menses. So if you see the symptoms, okay, extremities. associated symptoms, as I was saying, are very important to look for while prescribing. Sorry, it's increased pain. Got stuck. So sorry. Menses during aggravation. Okay, so pain joint menses during aggravation. If you see, okay, sore pain, aggravation pain, semicifuga is the only remedy which is mentioned. And if you go to goiter painful also, okay, menses before, to my surprise, okay, menses before, the remedy was present was semicifuga, again mentioned by Fatak. So that led me to prescribe semicifuga in her case. So a lot of accompanying symptoms also help us to prescribe. Again, coming to myelonitrosin, iodome, I think every one of us is aware. So iodome is one of the remedy which we think when it comes to thyroid gland. Bromium also I'll not go to because it's very well written and given. Only in cases that has mentioned about hard goiter, we need to think about this remedy. Now, as I was telling about examination of the goiter, right, which side it is important because a lot of remedies which are mentioned, okay. So if you see and if you go to goiter, if you palpate, if you feel it is more right-sided, have a set of remedies which could be used left-sided. Chelidonium is one of the very important remedy which is mentioned for goiter left-sided, okay. Accompanied by obesity, I want to show you this is the remedy, right? I might skip a few rubrics and I just show the important one because I don't want to push the time. So I had shown you that thyroid gland soft. I mentioned lapis alba, right? Hard, if you see fluoric acid, calcarea fluor, iodine, spongia like remedies are there. Indurated, you have spongia. Goiter painful before menses we had semicifuga. During menses you have iodine, right? Another thing I wanted to mention is other accompanying symptoms which we meant to. Okay, ectophthalmic trembling, choking associated. We have mephitis as the only remedy. Heart symptoms I have already showed to you, so I'll again skip this. Okay. Menses suppressed from. Okay, ferrum is another group of remedy which I wanted to focus. Ferrum and ferrum iode, one of the excellent remedies for goiters from suppression of menses. So someone who is developed goiter during a phase where the menses were suppressed, or she has done a hysterectomy after which she has developed, sort of thyroid complaints, ferrum iode. Very good remedy to think of. Okay. Pregnancy during, puberty during. This is the rubric. I had again a case, okay, of a young girl, 10 years, okay, that is a pubertal age, where she had come up with goiter. Now, that is very common, physiological goiter during puberty, but along with that, her TSH levels had overshoot. TSH had gone up to 28, and that is where the parents were concerned. Okay, so you have rubrics like external throat, goiter, puberty during, where calcarea iode, hydrastis are the remedies which are mentioned and which are given. Okay, acute diseases. Okay, so with this, I think I'll end the session. A few take-home messages. Like, to be honest, okay, homeopathy is simple, and we need to really see what actually we need to treat in the patient. Look at the symptomatology. Try to find the characteristic symptoms, and don't complicate it much. Be a student for life. Keep reading, and to be honest, I'm quite young. Still, I'm into practice in 8 years. I'm still exploring exploring, still reading a lot about a thyroid and other diseases which are coming to me, and trying to change my approach as in well I get stuck. So don't have any fixed ideas. Learn all the approaches, read from all, and as the patient demands, okay, try to use those approaches in the patient. And being a homeopath requires a lot of patience and a lot of positivity, and being focused is very important. So this is a little bit about me. Twinta has mentioned about this in beginning. But if you want to contact me or if you have any queries, this is my number 9892245776, or you can even write to me on my Gmail account. And in case of if you, because 2 hours, and in 2 hours it is really difficult to share so many things which I want to. If I am not able to solve your query today, you can write down to me on my mail. I also have an Instagram and YouTube channel where I regularly put my updates named HomeoHeals. Okay, now this is a quote which relates to I feel homeopathic doctors, that never complain about the difficulties in life, because God always give the hardest role to his best actors. So we as homeopaths, I feel, have the most difficult job, okay, because we have to really from the vast ocean of remedies have to select a remedy for our patient and treat them. So our job is really difficult, but that is the plan of the God, and we need to be patient and focus on that. So with that, thank you, and I hope this session was informative for you all.
It definitely was very informative, ma'am. So shall we take up the questions that we have?
Yeah.
Okay. So the first question is by Dr. Priyanka. My question is, when should we advise the patient about starting a homeopathic treatment if he is on Thyronorm? And also, what should be the course for complete cure? In the sense, how many months it will take for complete cure?
Okay. All right. So yes, the question is very relevant. So talking about when start, you can start the treatment anytime whenever the patient is, even if the patient is taking Thyronorm. As if I show you 2-3 case example that the patient were taking Thyronorm along with homeopathy. So at any point of time, you can start homeopathy and then taper the Thyronorm doses. Okay. So once you see that the patient symptomatically is improving, or if the thyroid report is improving, or sometimes it might happen because of L-troxin, thyroid levels are normal, then it becomes difficult for us to judge how to reduce the Thyronorm doses, right? So if you see that symptomatically the patient is better and you're going on a right track to start tapering the Thyronorm doses, I think within few months, roughly within 4 to 5 months, you should be able to stop the external Thyronorm completely and only be on homeopathic treatment. And how long to treat? Okay, this is a question which I am also still finding answer to. But to be honest, within on a roughly period of 1 year to 2 years, okay, with homeopathy, I have seen that we can stop the treatment and the patient on their own. It also depends on the course of which the patient is coming. All right, how long is he suffering? What are the symptoms? But roughly within 2 years, I think of taking homeopathy, you can stop the homeopathic treatment also. And after giving anti-miasmatic remedies, and you feel that the patient is good, you can stop the homeopathic treatment. And so roughly within 2 years, I think the patient, you can reverse the thyroid pathology. Yeah.
Thank you, ma'am. Dr. Deepa wants to know which book you would suggest to learn about the miasm.
Okay. So there are a lot of books which are there about miasm. So if you want to read about exclusively about tubercular miasm, also Dr. Allen has written very exclusively on tubercular miasm. we have Dr. Roberts, who has mentioned very exclusively about miasm. So Dr. Roberts' philosophy and Dr. Allen's notes on miasm is something which I refer to. Obviously, if you want, we have Hahnemann has mentioned about miasm in his chronic diseases. So these three books is what I would suggest to read.
Dr. Forum is asking regarding the first case about argentum nitricum. Was it a partial simillimum since you changed the remedy?
Was it a
partial simillimum, argentum nitricum case?
Was it a partial simillimum? That's what she is asking. Okay.
Yeah, she's
so
asking
now
if
see, it is very
argentum
difficult
nitricum.
to.
Yeah, she's asking
yes, I got the question. Yeah. Yeah. So I think the question has come because I changed from argentum nitricum to Staphylococcus aureus, right? I don't think that argentum nitricum was the partial simillimum at that point because the symptomatology which she present, okay, the indicated remedy that time was argentum nitricum, all right. But as the symptoms changed, okay, the symptoms changed, I had to change the remedy. The phase, the picture of the mind completely changed, and this happens. You cannot be maybe sometimes one remedy throughout your course as the surrounding changes, as your environment changes, the remedy may change. So here in her case also, after marriage, what happened, her environment suddenly changed, okay, the responsibility suddenly changed, people changed, and that is why I feel the remedy also had to be changed. So I would say argentum nitricum was the indicated remedy that time when I prescribed, and then the next time the symptoms indicated to Staphylococcus aureus, so that was given.
Okay, thank you, ma'am. Dr. Rama has a question about the argentum nitricum case again. So she says there gland boils, offensive perspiration, anxiety, anticipatory anxiety. Isn't argentum nitricum one of the hottest remedy in our materia medica?
Yes, it is. I think argentum nitricum thermally it's not clearly mentioned that it is a hot remedy, all right. But recurrent boils and what, I did not get the question. She's saying why argentum nitricum was prescribed.
Yeah, in the case it was chilly, and I think she's wanting to ask that it is a hot remedy. So how?
Okay. So in that case, all right. So the thermal modality was that she was aggravated because of cold draft air. Okay, she was aggravated because of cold, and argentum nitricum has this modality. You read in America, all right, where that where they are sensitive to cold air. Yes, I think Dr. Rama said that Silisha would be more indicated because she had this boils also, and she had this anticipatory anxiety also, right? So few things which made me select argentum nitricum, okay, as compared to Silisha. First of all, Silisha people have somewhat, okay, initially has lack of grid. That means initially also when she mentioned that she has anxiety as a child, stage fear, okay, whenever she had that fear, she was able to perform. Okay, there has never been an incident where she was completely blank or she was not able to perform, which initially is presented in Silesia, and as they evolve, okay, they are able to also perform. But that aspect was not there in her case. Secondly, as I said, the anxiety, okay, anxiety about health, the anticipatory anxiety, okay, which was more like argentum nitricum, and the speech which was hurried, okay, so impulsive, nervous, and hurriedness. These were the three things, okay, which led me to prescribe argentum nitricum more than Cyclin in her case. Okay, if you would have seen the patient, okay, her speech, she was continuously speaking in such a fast pace. She was so impulsive. They were overcrowding, and that made me think of more argentum nitricum than Silesia.
Thank you, ma'am.
I hope I answered that. Yeah.
Yeah. With respect to the second case where you began with tuberculinum, Dr. Aarti wants to know, should we start with anti-miasmatic remedies?
Should we start? So yeah,
Should we start?
Aarti, yes, definitely we can. Yeah, we can start with anti-miasmatic remedy. Okay, why we cannot start? So again, we have to understand what are the indications of the patient. We need to prescribe on that. And in her case also erraticity. Okay, that was a main indication which was leading to a symptomatology, and that needed to be addressed, and that's why we can begin with anti-miasmatic remedy. And if you see, there are many cases where I begin with an anti-miasmatic remedy. One was tuberculinum. Even Drosera was an anti-miasmatic prescription, which was done.
Okay, ma'am. The next question is regarding the spongia case. A spongia is a short-acting remedy. How can it give full cure? Can it help towards the cure?
Yeah. So again, spongia here was a phasic remedy. All right, it is going to help us to, or you can guide us to the process of cure. It is not going to cure the case. So what I was telling about the associated symptom remedies, all that symptom remedies will come up when we are stuck in a case and they were somewhere going to lead or guide us to cure. So spongia alone is not helping us to cure in this case. After spongia, if you saw, I have given medorinum, and maybe in between again I'm going to give the indicated remedy. Okay, the spongia was just a remedy to remove the symptom which was associated with goiter, was not responding to any other remedies, and spongia is going to play the role and help us to bring out some other symptoms where we could get some other indication which will eventually lead us to cure.
Okay. The next question is by Harina. Why not tuberculinum? Ma'am, this is with respect to the Drosera case where you started the case with Drosera. Why not tuberculinum, and differentiation between the two when it comes to a tubercular miasm case? When should we give tuberculinum and when should we give Drosera?
Okay. So now, see, Drosera, tubercular miasm does not only has tuberculosis as a history. Okay, tubercular miasm has rest of the other symptoms also. So that's why I mentioned to read Allen's miasm on miasm tuberculinum. Okay, so he has mentioned tuberculinum group of set of symptoms. Okay, so if we get those set of symptoms once you read a book, okay, where the patient is lean and thin, and you have all those of symptoms which direct us to tuberculinum, you can think that Drosera here was chosen on the basis of family history and personal history of tuberculosis. Okay, that was a main indication rather than the miasmatic symptoms which are pointing towards tuberculosis. The main indication for using Drosera was your strong family history of tuberculosis, and per se she had no other symptoms of tubercular miasm for me to prescribe tuberculinum. All right. So, for example, the patient was not lean, thin. All right. So, all the symptoms which we have of tubercular miasm were not present in this case, apart from the strong family history of tuberculosis and personal history of tuberculosis.
Thank you, ma'am. Our next question is, could you please highlight about when to use LM potency and the repetition?
Okay. So LM potency, I feel, is another big topic. Maybe we might take it up sometime. But yes, when to use LM potency, to be honest, you can use LM potency in any case where you feel that you need to repeat the remedy often, right? And you do not want any aggravations in those cases. So all pathological cases, even acute cases, all right, you can use, even for that matter, cancer cases, you can use LM potency where you feel that pathology is such that you will require repetition, and you don't want the patient landing up into aggravation if you prescribe in centesimal scale repeatedly, right? That is one case where you will use LM potency. Now, repetition, usually LM potency is either repeated frequently, so twice a day or thrice a day, depending on the case. Now, sometimes I have seen that even people are sensitive to LM potency. That means they might come up with slight aggravation also with LM potency, right? So in that case, how we dilute the centesimal potency in first dilution, second, third dilution. So if the patient comes up with aggravation with LM potency, you go up with dilution. So you can start 0/1 in third dilution and then step up the potency as well.
Okay, thank you, ma'am. And she's also asking how should we decide the repetition in other potencies also in thyroid cases?
Sorry?
How should we decide the repetition in other potencies also, not just in LM potency? In cases of thyroid. Yeah.
Okay. So, posology. Okay. Now, if you're giving a constitutional remedy, indicated remedy, usually if you have seen in all the cases, my repetition has been infrequent doses, right? If I feel the pathology is such where I want to repeat the goiter, for example, if I'm giving for a specific complaint, like for example, I'm giving for goiter specific remedy like Fucus, if I'm using lapis alba, which is specifically for my goiter pathology, I will go into lower potency and I'll give it in frequent repetition, maybe BD or TDS. If I'm using a sarcode, for example, in cases I'm using thyroidinum as a sarcode in 3x potency. In few cases I use. If I'm using a lower potency, I would repeat it maybe BD or TDS also. So anti-miasmatic remedies, Nuzod and constitutional indicated remedy, usually I use in less repetition. The disease specific remedy, pathological remedy is one which I give in repetition. That too, it could be given BD or TDS also daily.
Hello, ma'am. Good afternoon.
Yeah, Forum, you can continue.
Ma'am, actually, I had a question regarding, like for a certain case, you used LM potency in 0/1 TDS, then you gave 0/3 TDS, and then you gave 0/5 TDS. So, like, why did we skip the two consecutive other potencies?
Yeah. Who is asking the
Forum.
question? What's okay? Forum. All right, forum. So usually now this has come with experience, right? Now LM potency we have a large scale to explore till 0/30. Okay, so this has come with experience that I have seen that if we step up the potency a little higher, okay, and the response is little faster, okay, and I just wanted the response to be faster and to shorten the duration. You can by 0/1, 0/2, then 3, 4, 5 also, okay, but because of experience, I know that this is going to require higher repetition, 0/4 repetition also, 0/5 repetition also. So that is the scale where I want to teach the patient. And so because of this, I have skipped 0/2 and I moved to 0/3 and 0/5. All right. So that I see the progress faster.
Okay, ma'am. Thank you. Thank you, Twinta.
Yeah. So I think we have cleared all the chat box questions. We just have one question. If we had given higher potencies or remedy and the symptoms relapsed after a long interval, same remedy of lower potencies are suggested by certain homeopaths. Could you elaborate this aspect if you tried in this in practice?
Okay. So the question is if higher potencies aggravate the symptoms, right? So the question is if the higher potency aggravate the symptoms.
Yeah, if the symptoms relapse after a long interval, can we start from the lower potency after we have finished the higher potency?
Yes. It is given in our in a lot of writings that once the higher potencies are exhausted, even Dr. Kent has mentioned that, and if you feel Okay, if you have exhausted till the last highest potency, if you have exhausted and if you still feel that if the same remedy is indicated and you want to prescribe, you can go back again to lower potency and start again. That can be done.
Okay. Thank you so much, ma'am. We have cleared all the questions in the chat box. So I think it was a wonderful session, ma'am, today. It took me back to my college days. As usual, your explanation was very clear cut and lucid for everyone to understand. Right from the basics you took, right from physiology, you showed the Burnett's approach, your clinical investigations that you advised, subclinical hypothyroidism, and everything you differentiated very, very clearly. Like I felt like I'm still sitting in college and listening to you. So it was very, very good lecture, ma'am. And you also focused on how associated symptoms are very important while repertorization, and you showed it live with your software. So that was also helpful because in a lot of cases, the associated symptoms have given the remedy for prescription and has given cure. So thank you so much for highlighting on that. And along with that, you focus on therapeutics also, where some of the uncommon remedies you focus like Lepis alba or amyl nitrosim, which is also known to give a good guidance towards the cure. So it was a wholesome lecture in totality. If I have to say, everything you have covered about thyroid, and this actually shows your interest towards thyroid disorders also. So we are very happy that Dr. Tanvi has come here on Musings to explain about thyroid disorders. And the last part, your quote also was very inspirational by Dr. Abdul Kalam. You selected the right quote, that God chooses the best actors for the hardest job. So I think that we'll take as a take-home message. So we as homeopaths should be ready for a harder world. I think the world is going to get harder and harder. And as homeopaths, we are going to evolve along with that. So thank you so much for ending on that quote, ma'am. You are an inspiration to all of us. Thank you for coming on Musing. And also, I would like to have a note on few of my friends who have joined from college. So good to see you all. I hope to see you all in our next Musing also. And Tanvi ma'am, we look forward to have you again on Homeopathy Musings with another topic.
Yeah. Thank you so much, Twinta. Thank you so much for inviting me. Thank you, Homeopathic Musing. And it was my pleasure taking session. I hope, as Twinta mentioned twice, that there are a lot of senior doctors also, practitioners who are attending this webinar. So I hope that it was helpful to them also, and it was informative. Thank you. And I look forward to come and take our session again here.
Thank you so much, ma'am. Thank you everyone for joining in. We meet next month on first Saturday. Okay. Yeah. Bye.
Bye.